It's kind of weird looking at the camera instead of looking at you now. I know, it's wild. So we are full live.
Yeah.
All right.
Welcome to the show.
Yeah. Welcome to Fertility Fact or Fiction. I am your host, Dr. Rahi Victory, a double board certified reproductive endocrinology and infertility specialist. And tonight, we should have advertised and promoted this. My dear friend, a good buddy, eating pal, hopefully cottage compatriot this weekend, Tariq Ibrahim from Ibrahim Strategies Group is finally on the show. So we've kind of changed venues and he is here now. So welcome to the live, buddy. I mean, now you're finally part of it. This is Dr. T, everyone.
After many years of being behind, I am now at the forefront, showing the world my true talent and intelligence. Dr. T will amaze everybody today.
Well, welcome to the forefront. Good to have you. And so we thought about doing an article today, but with the new tech, we thought we'd try this position and see if the scenario works out well, and then we'll have to see how we integrate in another element like an article. So there is a really good article I want to review. It is about a double trigger and the use of double triggers and whether or not it is better or worse. Those of you who are fans of the show know that we've been promoting double triggers for quite some time now. And so I've been talking about that for a long time. New meta-analysis systematic review that shows whether or not it's helpful. Sneak peek, it's very helpful. And so we are very excited to kind of present that data and show everybody how it impacts things. We're very pleased about that. We also just released a video where we interviewed one of our amazing surrogacy patients who was a patient previously of mine and then became a surrogate for some of our clients through an agency. And she talks about the journey and what's involved. So if any of you want to be surrogates or have an interest in becoming a surrogate, or if you are intended parents thinking about a surrogacy journey, this is a great episode for you. So check that out. That's up on our YouTube and our Instagram, both.
That's right. On YouTube and on, no, it's actually just on YouTube. It's a special. It's a 20-minute special on the journey of a surrogate.
Oh, okay. Cool.
So it goes through the whole details, the ups, the downs, everything. It's worth watching.
And she talked a lot about the impact of weight and fertility, which a lot of surrogates are concerned about because we are concerned that our surrogates be excellent surrogates. And so there's been feedback about whether or not it's reasonable to ask surrogates to be an optimized weight. And so she talks about her perspective on this. So I really appreciated her candor there because it's an important topic and it's a sensitive one and it's not easy to bring up. So great insights, lots of information. Super, super happy to have had her on. And so, check that out on our YouTube channel, please. Lots of thumbs up and love for Chantel. She was awesome for being on the show. And we'll talk about some articles upcoming. And next week, we've got our friendly neighborhood nutritionist on with us as well. So, and she's coming here. It's going to be an in-house thing.
It's another live in here. So our setup will remain still great because now you got hosts people coming in here for live. So it's a big deal.
Does that mean you'll be off camera? Oh, you might have to.
I'm not leaving the camera. Once I'm on, I'm not getting off. But people are mentioning that, where are my scrubs? People are confused.
Yeah, I'm the one in the scrubs. We'll probably have to get some FFOF scrubs. We should do that. We should get some.
I'm on the show.
Yeah.
And I'm obviously a doctor in the show. I need to look the part. This warm Canadian sweater thing.
We need to get you some figs.
Not working.
All right. So tonight we're just going to take your questions live. We're happy to do that. Anyone who has any questions about their fertility journey, I just can't give you like specific kind of patient-focused medical advice because you have to be a patient, but general questions, no problems. Feel free to ask. We just made some videos about some crazy stories coming from Israel and from Nigeria. So expect those coming up soon. And I think, when are you releasing the third Dick Award? Oh, that's not till December?
Yeah.
In December.
Yeah.
That was the frozen egg one. Mm-hmm. Oh yeah, it's time now. Yeah, it's a
we'll just fast forward. I got nervous about the second one. I didn't want to put it out.
Yeah, so you can flip that out now. Yeah. Plus, we got to make one with that the white T-shirt guy. Yeah, that's right. You didn't bring the stuff, did you? Bring the stuff. I brought everything just in case. Oh, really? I don't have my gear. I gotta get the suit. All right. Questions. Mm-hmm. What have you got?
Wait a minute.
By the way, did you have like some kind of tea disaster in there? Because there's like tea powder all over the counter.
So it's not a tea disaster.
It's not a tea
It was
disaster.
A faulty tea bag.
It was a faulty
manufactured incorrectly, basically setting me up. I take the tea bag out of the little tin.
Yeah.
Put it inside.
Yeah.
That's the obligation of a human being. There's nothing else that can happen.
Yeah.
As I'm taking it out, showers all over the sky.
Why'd you take it out? Oh, out of the can?
Out of the little tin.
Oh. So you had a little tea disaster after all. All right. Fire away.
We're going to start on YouTube.
Okay.
Dr. T in the flesh. Whoa.
There you go.
All right, next question.
Yeah.
But I just want everyone to know. Let me go here for a minute. This is gonna. I might overdo it today, but if you guys have any questions for me, feel free. I'm here to answer all your questions, fertility and non-fertility related, for what it's worth. And as always, if I can't answer it, Dr. Victor
will be here
to assist me in answering these questions.
Yeah.
All right, first question.
Yeah.
Dr. B and the great T.
Already a good start.
Yeah. 14 weeks pregnant with
SCH
increasing from 2 by 2 centimeters to 5 by 3.
Oh.
I've stopped the aspirin, no spotting. I'm concerned for poor outcomes. Did the aspirin worsen it?
There's no way to know, but take ALA. A couple of weeks ago on our show, we reviewed the fact that alpha lipoic acid is massively beneficial in cases with subchorionic hemorrhage, rapidly reduces the size of the hemorrhage, reduces the cramping associated with it, and likely reduces risks of miscarriage and reduces bleeding. So take alpha lipoic acid. It will significantly help you. I now give it to all our patients with bleeding. I'm actually wondering why we don't just give it to everybody. Probably run a randomized controlled trial on that. And so there is no question that you should try that out and see how you do. And does the aspirin make it worse? I mean, that's kind of spilled milk at this point, so I wouldn't worry about it. But for sure, you want to get on the alpha lipoic acid and then take it easy. No heavy lifting, no straining, pelvic rest. Not necessarily because it makes a difference, but because you're forever going to regret it if you don't do that and something happens.
Hey, doctors, what tests? Should I do this?
Yeah, sure. Yeah. Show a little of you. A little here, here and there.
The problem is I'm just reading, so I feel like my vision is a little bit, I'm squinty eyes, but I think they'll be all right. They'll be forgiving. Hey, doctors. What tests do you do to diagnose endometriosis?
I know it's me, man.
How long is the wait to get the test done? And how long does it take to get the results?
For endo? Yeah. So there is one test for endo. There's one test in the US called Receptiva DX. It's useless, so we don't do that. And then there is another test in the US, in Canada called Endomirror, which started and then stopped because Health Canada got involved and shut them down. I'm not sure what happened, but they just sent out a note to everybody saying currently not available. So I'm not a big believer in endometriosis tests. The only way to actually diagnose endometriosis is to operate and see if it's there. People claim they can see it on ultrasound and these, clinics that sort of have specialized ultrasound techniques and transrectal and transvaginal, and they look for nodules and this, that, and the other. I don't believe in any of that stuff. If you look at the actual research, it shows a 67% detection rate. You can get a little bit higher with MRI. Even that's not amazing. So at the end of the day, the gold standard, the definitive diagnosis, it's surgery. How long does it take to get into surgery in Ontario? 6 months to a year. It's a long, long wait.
If only one follicle is responding to stims and is 19 millimeters, is it reasonable to switch to IUI? The clinic told me to take a trigger and try naturally, but we want to try IUI as we haven't yet, waiting to hear back.
Yeah, I mean, it depends on what your ovaries are capable of, right? So if your ovaries are capable of only making one egg and you wanted to do IVF, do natural cycle IVF. There's nothing wrong with that. If you want to do IUI, do an IUI. Is it going to give you a better chance than natural? Depends on what's wrong, but it's certainly possible that it's going to give you a better chance than natural. But that's up to you. So if you've got weaker sperm, yes, you're going to get a better chance. If you've got a tight cervix, you're going to get a better chance. If everything's normal and you're doing it, or you have unexplained, it'll be a little bit of a better chance. But overall, usually you're going to see some improvement. If the sperm is extremely weak, you're probably not going to get much of a better chance from an IUI. So it all depends on what the diagnosis is.
Unexplained infertility, 2 unsuccessful retrievals, no viable embryos. What questions or tests should I be asking for?
Oh, that's a good one. So I'd need to know more details about why you didn't get viable embryos. No eggs retrieved, or they just couldn't fertilize them. They fertilized and didn't make it past day 3. I need a lot of details on that one. So you should be DMing me and we'll figure it out. I would need a consult, full disclosure, so I can understand what's going on. But I need to know the details of that in order to be able to help you. So once I know what's going on, then we can have a chat about here's how we fix it. It would depend on whether it's male factor, female factor, both, and whether it's something correctable where we can use priming and so on, or something that's not correctable. I just got another message yesterday on Instagram from someone. Actually, we got to post that, where they said, after years of trying with no success, we used your protocol for endo, and we are now 14 weeks or 16 weeks pregnant. So we love those messages. All sorts of people have had success using our protocols because we really do focus on individualizing and making sure that everything is done perfectly. And so it's kind of a critical element for us to make sure we treat you, the patient, not just the condition. So we're not just sort of treating everybody the same way. Oh, you have infertility, you need IVF. That doesn't work. You need to give people options, choices. It's called shared decision making. And I don't even really consider it shared. My job is to educate you, and your job is to decide what's right for you. I'll guide you, I'll advise you. Obviously, we have a different knowledge base than you do, so that's critical. But my job isn't to decide for you or push you into something. My job is to educate you and then let you choose what you want to do.
Carly's on the show.
Oh, hey, Car, how are you? We haven't seen you forever, Carly. That's awesome. Welcome back. How's the baby? Very cute baby.
Estrogen priming.
Oh,
Before egg retrieval for 31-year-old endometriosis, 24 AFC, 2.94 nanograms per mil.
wow. So estrogen priming in general has no benefit. It is only designed for women who have weak ovaries, and you definitely don't have weak ovaries. And giving someone with endo estrogen before you do an IVF cycle makes zero sense. Why would you inflame the endo right before you're going to inflame the endo? It's like double whammy. I'm not a real believer in that. So that doesn't make any sense to me. I don't know why they would even do that for you. Yeah.
We need more likes on TikTok.
We need more likes on TikTok.
More likes on TikTok.
Okay, more likes on TikTok, please. Yeah, not enough.
Now I can just say to myself, we need more likes on TikTok.
You need to instruct people now. You got to tell them what you want.
Here we go. Numbers are starting to climb.
Yeah.
They need to do rapid fire figures. Don't stop.
Yeah.
On day 12, on day 12 of a modified natural FET, got sick yesterday and ran a fever for 12 hours approximately.
Oh.
What are the implications on my cycle? Should the plan be adjusted? Would otherwise likely trigger tomorrow?
Wow. I'm not a fan of doing any kind of embryo transfer around any kind of inflammation or infection. The immune system is critical to the implantation of the embryo. And if there is infection or inflammation, we know that that's significant. Tarek and I reviewed an article.
Always revealing.
Yeah, always revealing, about, I don't remember, 2 months, 3 months ago, where we looked at the relationship between your parameters in your CBC, your complete blood count, which measures like your hemoglobin, your white blood cells, your neutrophils, platelet levels. And they had this calculation, and they could assess your chances of success simply based on what they called the systemic inflammatory response score. And so they just made this very simple calculation from a CBC, and they could actually predict if you were going to be successful or not. So yeah, there's all sorts of things we can do to figure this out, but I would be very hesitant to let somebody go ahead when they've had a fever that close to an embryo transfer. I personally, if it was my patient, I would be saying cancel.
A very good question.
Okay.
Do you charge double for a dual stem, since it's two retrievals?
No. No. So we recognize that the people that need duostem are generally women with weaker ovaries who are struggling to begin with. So we actually reduce our price. I think it's 37% for the second cycle. So one cycle is 12,000 for us, 11,995. Two cycles is 18 something. I forget, 18.9 or 18.8. So it's much cheaper. Like it would have been 24,000. We reduced it by like $3,000 or $4,000. So it's much cheaper when you do it. When you do a double cycle, a duo stem with us, and a triple stem is even cheaper. So we do try and accommodate for those patients because they're struggling, and our job is to help people. It's not all about money. I spoke to a couple from which state were they in? Washington? Oh, I can't remember. One of the states. I think it was Washington. Just recently, they spent 40,000 US on one round of IVF. We had a Canadian patient just came by. They were deciding what to do with their embryos. They had done 3 rounds of IVF at another clinic in Toronto. So 3 rounds with us is like a triple stem, 25,000 plus your meds, and you're done, right? So, even if your meds were crazy expensive, another 15, 16,000, 18, let's say crazy 20. So you would have spent 45,000. What do you think she paid in Toronto for the exact same thing? No difference. In fact, we succeeded. They didn't. So even better here, but
So Dr. T, as a wise individual that very familiar with the fertility industry, obviously pricing is something I go through all the time, reviewing these things.
Yeah.
Absolutely. 120. That's the number I'm throwing out there.
120,000.
So I'm right.
You're right.
I'm right. So guys, I hope you saw that. Like, I know how you feel. I'm doctor of the people, Dr. T, working here for you guys.
So yeah, 120,000. Like that's crazy. So we try and reduce our prices for people. We don't want them. Isn't that insane? 120,000 for 3 cycles. Like they want another baby. They needed a surrogate, and they can't. Yeah, that's mental. Anyways, next question.
How concerned should a mom be about CMV infant deafness if she currently has a cold during pregnancy?
If you've never had CMV before and you're currently infected with CMV, you need to talk to your doctor, your obstetrician right away. So that would be critical. But if you've had CMV before and all you've got is a cold, that doesn't do anything. So maybe I'm not understanding the question properly, but if it's your first time acquiring CMV and you're currently pregnant, you need to see a doctor right away. There are significant effects from that.
My period has been regular for the past 3 years, but the last 2 months it's been late. Why?
Oh God, that could be a million different things. Reasons. Hey, that would be a great video. Reasons for a late period, right?
Just answer it, and
You'll turn it into a clip.
Yeah.
Reasons for a late period. Number 1, you are pregnant. Number 2, you are pregnant. Number 3, you are pregnant. Number 4, stress. Number 5, weight changes. Number 6, medications, infection, anything like that can do it. 5, exercise. Oh, I'm on 7. Number 7, exercise, especially heavy exercise, like training for a marathon, that kind of thing. Eating disorder. All of these can cause changes in your period.
What about poor nutritional habits? Like, how important is diet in terms of maintaining a regular period?
Yeah. So if your diet is poor and you're gaining a lot of weight, it can throw your cycle off. If your diet is poor because you're not taking in enough calories, it can also throw your period off. Yeah.
Dr. T, question there.
Yeah. There is. I don't even know how you're keeping track of all that.
Not comparing. People get upset today. I get it. Because I haven't even come close to read. I gotta think this through here. A lot of this going on. Not related to fertility at all, but a medical question nonetheless.
Okay.
Perhaps you would like to shun, because my subspecialty is infertility.
It's infertility.
Yeah. So once we would get out of that realm, I'm really out of my scope.
All right.
I'm really out of my scope. So the question from this viewer is, how does your leg fall asleep?
Oh, that's a great question. It has to do with compression of the nerve or compression of the blood flow to the muscle. And then it gives you that horrible tingling sensation because essentially the muscle and or nerve have lost blood flow and are like having hypoxygenation. So you're not getting enough oxygen there. And so it gives you that horrible tingling feeling until it reperfuses and becomes normal again. I don't know why the hell they'd ask that on a fertility show, but
because you're a doctor.
Because I'm a doctor.
I'm also a doctor, but I just didn't know the answer.
Not a fully licensed. Let's just be careful. I don't want to get in trouble. Yeah.
For all legal intents and purposes.
Not a doctor.
I'm not actually a doctor. But if you believe I am, you better believe I am. Okay. 31-year-old female, stage 4 endometriosis.
Okay.
24 AFC, 2.94 nanograms per mil. AMH regular. Ovulatory cycle. Partner is 36, male factor, infertility, low count morphology, and motility, plus 40% DNA fragmentation.
Woo.
First egg RET. I think that's
retrieval.
First egg retrieval. I guess she's looking for support and advice.
Make sure nobody's smoking, drinking, or using drugs. Take all your vitamins and supplements. Make sure he is too. Ejaculate every day or every 2 days. On the day of the retrieval, studies have shown that ejaculating once and then 3 hours later again, the second sample has 80% less DNA fragmentation, which would be enormous in a case like that because you're going to go down to essentially just 8% from 40%. So that would be tremendous for you. So I would certainly recommend that. That'll make a big, big difference in your outcomes. Aside from that, I mean, there's not a lot more you can do. Just make sure they do a good stim and don't drag it out too long, trying to get too many eggs.
Got to give a shout out.
Yeah.
Shout out to all my fans. Comment number 1 from Paige T is the doctor of the soul. Paige, I love you. I love you, Paige. Second comment, that's fire, straight fire from Nicole. Dr. T is in the house.
Dr. T is in the house.
I'm here on my seat in the house. In the house that Rocky built.
Yeah, in the house that Rocky built. That's right. Well, Rahi, Mara, Lisa, Wendy, all the other staff, lots of people.
I think I had something to do
Kim,
with it. I think
Tarek,
I have a little
yeah,
brick here
yeah,
or there, a little brick.
yeah. Did we didn't start working until we were here, right?
I came right on the transition. You were moving here.
Is that when we started?
We signed the papers at the other place. You were still in between, like you were still there. This wasn't done yet, but we transitioned here.
Yeah, because our first ever show was at the red chair table,
That's right.
right?
That was the first one.
And we did double insemination. I remember that.
Double insemination.
Yeah,
That's
yeah,
right.
yeah.
What's going on? Okay. Charles has a question. She thinks I'm ignoring her. I'm not. All right, Charles. This is just for you. Could you push record on that camera real quick?
Here.
Yeah. If not, it's okay. I'll catch it. I'll just take the camera off me and get to it. All right. Don't worry. I'll get it. You got it?
How's that?
Beautiful. Yeah.
There you go.
Now you're doing my job.
We're doing role reversal.
Charles's question: my glucose is 9 on the left finger and 6.8 on the right finger. What do I trust?
What?
Yes.
That doesn't even make sense. I'd probably just repeat that, Charles, because that doesn't make a lot of sense. And I'd probably get your glucometer calibrated. That sounds like it's not accurate. There's no reason why your sugar would be one thing on one side, unless you used, even then, this is a stretch, but if you were using the arm that had the lower sugar a lot more, okay, I could get it. But otherwise, no. And even then, like, I've never heard of that before. That would be bizarre.
So we got a question. Okay. What is the success rate? So obviously my success rate is 100%. Thought I should put that out there.
Nigerian clinic.
That is my success rate. As Tarek Ibrahim when I operate, whenever that is.
Yeah.
Never in this building for all intents and purposes.
Yeah. Tarek has watched an IVF retrieval, but that's it. By the way, we got to finish that video too. Yeah, we have to actually get your conclusions remarks on it. Oh, yeah. And we have to film the ultrasound too.
Yeah, that's right.
Okay. I pushed that.
No, that's okay.
Is it a battery thing? Or
no.
Okay. So, yeah, what is the success rate? The success rate depends on a million different factors. Sperm quality, egg quality, embryo quality, number of eggs you have, your age, your partner's age, your body mass index, your habits. There's a lot that goes into this. So what's our overall success rate? If we take all comers, right now we're running around 65%. That's taking everybody. But if you isolate it to, like, younger, healthier people with genetically normal embryos, 85.7%. So it all depends on who we're talking about and what we're ending up with.
So my cycles keep getting canceled due to high estrogen. They don't seem concerned. Just keep telling me, report next cycle.
So I'd probably consider doing priming. We would use DHEA, testosterone, human growth hormone. And the other thing you could consider is doing a luteal phase stim so that you don't have to worry about the high estrogen levels. The days of monitoring the estrogen levels are kind of dead now. The only reason to do that was because the follicles were advanced and they'd be out of sync. But because we now routinely do the duo stims and the triple stims, it doesn't matter what your estrogen levels are. You just have to understand when to start. So it might be worth letting that egg go, wait 5 days, and then start your stim, which is the whole essence of a duo stim.
There's a battle on TikTok between Carly and Chels. Carly saying that Chels didn't wash her hands. That's why she's got different reasons.
Wow.
Dr. V and
I'll bring the little turtle tub in the pudding if they want to battle it.
Success rate of the PGT normal embryo and a known surrogate. How many transfers before success?
With us, generally 1, maximum 2 usually, assuming the surrogate's a good surrogate and everything else about the embryo and stuff was good. Normally, we're successful on first try, sometimes on the second try. We just did a embryo transfer into the owner of a surrogacy agency, first try, pregnant, things are going well, betas are rising. And we just saw the couple that were the intended parents at Brussels. They actually came just to be with their community, which was really nice. They were already like ready to go. Their journey was already started, and they were just happy to come see friends and us. So we're actually going to hopefully bring them out with us next time we go to a conference. They're going to come and rep us. So it's kind of cool. Yeah.
Doing anti-probiotic regimen you prescribed following fertility.
Okay.
My surgeon here in the US wants to know if I can do a hysteroscopy while on the regimen or wait till after.
My question to your surgeon would be, why do you need a hysteroscopy? Generally speaking, you shouldn't need a hysteroscopy. And I definitely would be very loath to let you do one after you've done the antibiotic, because they're going to be introducing instruments directly into your uterus, which no matter how sterile it is bringing stuff from outside inside. And if we've just restored everything, I wouldn't want you to do that. So hysteroscopy is overused in Europe and the United States, in my opinion. It's constantly being used when it's not necessary, because it's looking at the shape of your uterus and polyps and stuff. But you should be able to know that well in advance from an ultrasound or a saline infusion sonohystogram. And it's not like stuff changes. So what are you going to learn from a hysteroscopy? Nothing. You're going to learn that you're poorer and your doctor's richer. I don't believe in that model of medicine. That's a bad model. You know, I can see from here that the wrong button was on. So I was going to say wrong button, but then I can't.
Why is it frozen? Wrong button.
Wrong button. Yeah. I'm going to have to learn like to tap the edge of the couch or something. Wrong button.
Obviously, didn't push the button. On CD10 of letrozole FET cycle, US showed fluid in ultrasound, showed fluid in the ovary, suggesting a ruptured cyst. Lab showed prog 0.5 nanograms per mil, LH 2.78 mils. What do you make of this? Is there still a chance of proceeding with the FET?
It's hard to know, because you'd have to know if that was your follicle that had released or if it was just a cyst. So I would just bring you back the next day and see what the progesterone is doing. If it's rising, you're stuck with the timing based on when you think you actually release the egg. But if you don't see a rising progesterone, you're still safe. You may have just had a simple cyst and it popped, and that's okay, because those have no progesterone production.
I've had a D&E that required stitches to stop the bleeding.
I had a D&E that required stitches?
Yeah, several hysteroscopies, and most recently a lap for stage 4 endo.
Oh,
Do I need to worry about an incompetent cervix?
not necessarily, although the more DNCs or D&Es you have, the higher the risk of an incompetent cervix, but not necessarily. No.
Hi, doctors. Age 33, I've done 7 transfers, 5 euploid, 2 mosaic.
Oh,
All failed or chemical. Have tested positive for endometritis twice over span of transfers. What other tests should be run? Blood tests normal.
I would want to know how you tested for endometritis. If you did a biopsy, that's useless. You should be doing a PCR test like fertility. So that's what we would advocate for. I would want to test your immune system and see what your immunological response was like. We would want to do a saline infusion sonohystogram with us, because we seem to find things where other people don't. I need to see your partner's sperm DNA fragmentation test, oxidative reduction, stress in the sperm, seminal fluid. You would need a thrombophilia screen. We would check your thyroid, your vitamin levels. I would need to make sure you don't have endo. Like there's a lot to look over something like that. I am so sorry you're going through that. That sounds wretched. 7 embryo transfers. That's a lot. That's a lot. Right button.
Right button. I'm learning, you know.
You're getting it.
Part of the process.
Yeah. I see that. Yeah.
Hi, docs. Love that we can see Dr. T tonight. Love that I can be here with you guys.
Yeah.
I can't lie about this. This is
food
for the soul.
Although you do have your own social media stuff.
That's true. I'm on all the time. I'm not on the fertility aspect. I don't see when I'm actually not being a doctor. I don't even pretend. Only when I'm working. Only when I'm working am I a doctor.
Hey, doctor.
Doctor.
Yeah, we need to start doing
100% doctor.
Yeah.
But you put me in scrubs.
Then you're all the way.
Then you tell me what's the difference.
There you go.
So back to the question, of course.
Yeah.
The doctors tonight. DOR and MFI and had 2 failed ERs. Last one was on high stims and worse results with 3 retrieved and 1 made it to poor quality blast. What's next?
Don't do high stems when you have DOR. It's useless. It's actually a really good way to burn out your eggs and make you poor and make your doctor rich. Never accept a high dose protocol when you have severe DOR. It's literally useless. Whether you take 150 of Menopur or 450 of whatever combo, you're going to get 3 eggs. So why bother taking more? So your options would be priming if you do want to try and make more. Depending on your age, you may want to consider ovarian PRP. When I talk about priming, I'm talking about DHEA, testosterone, human growth hormone, not birth control or estrogen. Those are useless for that. We would recommend you try that first and then see what your results are like. That should give you a very decent chance. What's up and coming is our new protocol where we don't use meds and we just retrieve your eggs when they're immature and then we mature them in the lab. So that might work really well. We don't know yet, but we're going to be trying it for people and it'll be very inexpensive compared to conventional IVF, like less than half the cost, plus no meds, which makes it probably roughly around a third to a quarter of the cost of a normal IVF cycle. So that might be helpful for you too. But reach out and do a consult with us because these are the kinds of cases I personally love because they're a challenge and we got to work through all the details to figure out what's best for you. The other thing you could consider is just natural cycle IVF. You make an egg, get the egg, turn it into an embryo. Why do you need to take meds at all? 3 cycles of IVF with no meds is going to be roughly the same cost if you go to a reasonable center as 1 cycle of IVF trying to get 3 eggs with a ton of meds. And you probably get better egg quality and embryo quality from the natural.
Can narcotics be prescribed in the pregnancy for hip and back pain? Is this common practice?
Narcotics? Like a morphine, that kind of thing, narcotics? Yeah. Can it? Yes, it's safe. Is it addictive to you? Yes. Is it addictive to the baby? Absolutely. So if it's chronically being used, your baby's going to be born addicted and that has lifelong impact. So we don't use it for anything other than like a crisis situation or a situation in which we don't have a choice, like the pain is unbearable, you've tried everything else. So we try normally to avoid narcotics, obviously, but sometimes your choices are limited. You can't use non-steroidal anti-inflammatory drugs in pregnancy, so we try to avoid those. It's a good thing you remember which camera was on.
You know, when I plugged them in today, I said, number 1 is Raheem. the main event. You know what I mean?
Oh,
I'm close number 2.
I'm happy being second fiddle. I don't have to be number 1 all the time.
Flip the whole show around, man.
Yeah, we can swap spots.
How many rounds of letrozole do you recommend before moving on?
I guess that depends on what the condition is. PCOS, 6. If you're doing IUI, it depends on your age. So depends on your condition. It's too vague a question. Sorry, flesh out some of the details there and I'll be able to answer better. But if you're PCO, 6, if you're doing IUI, 3 if you're over 38, 6 if you're under 38, those are reasonable numbers.
Dr. T, now that you've shown your face, I feel like you need to remind people that you are married. Guys, listen. This is merely research. This is
wow,
this is
they took it there, man.
This is, I'm doing for you guys. This is for you.
Wow, they took it there. Handsome devil, yeah.
Oh, speaking of handsome devil, we have comments on TikTok. It's way later, but since Fertility After Dark showed itself. Doctors are easy on the eyes. And not just that.
Apparently, that's more you than me, so hey.
No. Doctors, it's plural. And let me not say best looking doctors around. We all know I'm a pretend doctor, so to speak. So,
hey, not bad.
Not bad.
That's a good night for us. We had a good meal. We got a couple of nice compliments, helped some people.
For what it's worth, I do feel that this is a more entertaining vibe altogether for everybody.
I think it is too.
Right? Like, yeah. You know what, guys? Why don't you tell us? Is this layout of the show? No joke. Seriously, we really want to do good for you guys. Is this layout the way we're doing it? Me talking, Dr. Victory talking. Do you guys prefer it that way, or do you prefer it when we were in the other room doing it? What do you guys like? Put it in the comment section right now. If as soon as you hear it, say this room or the old format or seeing me. Let me know.
All right.
Yeah.
I have no idea which mic is on.
They're both on.
They're both on. All right.
For older women, what's the largest size of follicles at which you trigger before retrieval?
It depends on a case by case basis, but the older the woman is, supposedly the earlier you want to take them. So we aim to trigger at a max of about 18, but we do go over that sometimes. I mean, if you've got 4 follicles that are in the 15, 16 range, and you've got one that's 19, I'm going to wait a day to get the 15, 16s to the point of maturity, and I'm not going to care as much about the other one being a little bit bigger. So you have to do each case individually and look at all the details in there. But typically, at the latest, you want to trigger at 18. There is a guy in, I keep forgetting if he's Miami or California. I think it might be California, who believes strongly that you should retrieve eggs in a over 40-year-old at 16 and an over 45-year-old at 12. But he is using in vitro maturation, which is partly where we got the idea. And he is maturing the eggs in the lab, and he swears that you get better outcomes from that. So that's what we're about to explore with our new program, which will be a game changer. You know, I haven't told you this, but IVF across the world hugely slowing down right now. Everybody's numbers are down. I just talked to someone who shall remain nameless, who would know very well, and they said volumes in Toronto are way, way down. Our volumes seem to keep going up because we treat people well and we treat them honestly, and we're less expensive and we do a good job. So I feel bad for everybody else, but the volumes are actually going down. So you constantly have to look for new ways to innovate and provide better care. And whether that's more one-on-one and doing stuff like this or being there for your patients, you know, that's critical. I had a couple that I met in Brussels last weekend text me this morning, and they said, you know, some of our friends are likely going to stick with a different clinic in Toronto because of the location. Your location is a challenge. And I said, you know, all I can say is location's nothing, and we're now part of the Excellence Fertility Group with Dr. Zaneku from Tripod. So we have a Toronto branch that can do our stuff together. And so location's not a problem. And really, come on, coming to Windsor is a joke. But more importantly, the reality is that this person was able to reach out to me and access me directly on WhatsApp at 6 in the morning, and I answered with this long text about everything. And I said, are they going to be able to get that from their clinic in Toronto? And the answer is no. So I think it makes a big difference, the quality of the care that you provide.
So everyone likes this room, by and large.
Okay.
Massive like. The only complaint they're getting, and I know why this is happening, is that the mouths are moving on TikTok and the sound's coming a tad bit later.
Oh.
But that's because the way this is all jigged up,
there's a delay.
It's physically delayed for sure because it's shadowing on top of each other. So maybe next time we just do but then it won't transition as well. So
we'd have to have we'd have to put the TikTok camera over there or
something. No, I think this is good. I think a little delay. You got to focus more.
You know what we could do is we could get one of those little gizmos that spins.
Oh yeah.
And see if it's voice sensitive, and you talk and it rotates, and I talk and it rotates. That might work.
We'll see. Because then that's still, you have to run it through a computer.
No.
Yeah, you won't be able to just go live on it.
Yeah, it's the stand.
Yeah.
The stand rotates.
Oh, the stand will. So but it still has to go through a computer to go live on TikTok.
No, we would use it for the phone.
Oh, the phone is what's. Oh.
We would just go back to the old system.
Yeah, gotcha.
I think you're still on me.
Best looking guy in the building.
Oh, no.
Of course. Child says she'll come here and do it live and just spin the camera around for us.
Child's, you're preggers. You can't come here in the middle of winter. It's too far a drive, and I don't want you on Carnage Alley, as they call it up here. So please stay where you are.
Dr. B&T, you mentioned studies showing the GLP-1 meds might improve microbiome and reduce inflammation. Can you do a video on this? So interesting.
So I actually didn't mention a study. What I said was a family doc that's working with us swore by it. She said it alters the microbiome in the gut, and therefore it might. I haven't looked it up, but you know what? Let Tarek ask the question, and I'll pull up PubMed on my phone and see what I can find. GLP-1 and microbiome. Let's check it out.
I was definitely hoping to go a little bit longer on that one. Here we go. So, just finished my antibiotics prescription prescribed by you for fertility.
Is this the one we already did?
I don't think so. I now have a white-coated tongue.
Oh.
Could it be oral?
It's oral thrush.
Oral thrush.
Yeah, you got yeast. So you need nystatin, swish and spit, or swish and swallow. Yeah.
What's the protocol for endo, Dr. Victor?
The protocol for endo is on our YouTube channel. So we use 3 months of Lupron and Letrozole. We use 5 different supplements: NAC, curcumin, resveratrol, ALA, and coenzyme Q10. We use double progesterone, high dose, and we measure your levels. And then we have a whole immune protocol, which involves intralipid steroids, tacrolimus, and now metformin. So the timing and the doses and everything, do a consult with us and we'll tell you. And then we can go over everything then. Here we go. It looks like the gut microbiome actually promotes GLP-1 release. In other words, if you have a better gut microbiome, you potentially are going to be you may end up getting less weight. Here's another one: metabolic and gut microbiome in obese mice. So it looks like they get better bacteria from taking GLP-1s. There you go. There's proof.
For what it's worth, I never doubted you.
I didn't know that at all.
Never doubted you.
It's amazing the wealth of, even for you in your doctor role.
I'm not sure what this is for, but
even for you and I have learned a wealth of information. And how long have we been doing this? 5 years now, almost 5 years,
almost
right?
5 years.
5 years of doing this nonstop, like week after week, we learn something new, we present something new. It's made me, like, this show has made me a way better doctor.
This show has made me a way better doctor. That's how I feel.
Yeah.
I'm in family gatherings all the time.
Yeah.
Nobody ever says I got this problem. Nobody's outing themselves.
Yeah.
But I'll hear, hey, by the way, do you know? And I can't help but feel as I'm sipping on my tea, well, you know.
Yeah.
Nature of the beast, I guess.
It makes us better. Lifelong learning.
Can you talk about DNC for miscarriages and what to expect? I'm nervous when it comes to anesthesia.
Well, you don't necessarily have to be put to sleep for a DNC. We do them in the office sometimes, so you can do it in the office or you can do it in a hospital setting. Conscious sedation is fine with a cervical block, or you can do it with general anesthetic. Either one is fine. The procedure itself, generally speaking, is very well tolerated and very safe and very easy to do. You just have to make sure your doctor is not overly aggressive if they're using the curette to scrape the inside of the lining, because that can cause scarring and Asherman syndrome. When I do them, it takes me maximum about 2 minutes, and it's quite simple. We do them easily, safely, quickly. We never have any problems. So, yeah.
I've learned we have to do lit with my hubby before transfer. Yeah, before transfer. And we are using a donor for eggs. Is it a thing to be concerned about me reacting to the donor too? Is that a thing?
Not that we're aware of. Yeah, not usually. We're not aware of the lit problem existing for the donors, so that should not be a problem at all. It's more your immune system reacting to your partner's proteins, because it's not a female thing, it's a female male thing. We may get like kidnapped any moment because some creepy white van just drove by the window. Yeah.
Let them show up. I'll show them.
Yeah.
Got my knuckles ready.
Yeah.
How would you medicate someone with DOR and endo? Want to make as many eggs as I can, but not make endo worse.
So that depends on the severity of your DOR. If your DOR is really bad, you don't want to just keep taking lots of meds in the hopes that you're going to make more eggs, because you're not. Like I said earlier, if you do 150 or 450, you're only going to make 3 eggs if you've got really bad DOR. So it depends on the nature of your DOR. Priming will help you make more eggs without worsening your endo. I don't advocate for high dose protocols. That doesn't make any sense. It's just damaging to your eggs, damaging to your wallet, and not beneficial for your outcomes. So lower doses is better for sure in those cases, and possibly earlier triggers, so you're not exposed to as much dosage or high estrogen levels for quite as long. Natural is an option when you've got bad endo. We'll see about this immature egg retrieval. I don't know how well that'll work in that case, but it's an option.
So regarding the audio, we have very perceptive viewers.
Okay.
So when I switch screens on my computer from the streaming platform to Instagram to get your questions,
yeah,
it puts the Instagram screen on the computer, and it's TikTok then shares the Instagram screen.
Okay.
So the Instagram screen is lagging behind. You understand? Because it's playing via the live.
Oh.
So when I actually just have the normal stream up and going, everything's actually perfect. So we've actually hit the sweet spot. I'm just going to have to use my phone to get the questions and never open up Instagram on the computer again.
Oh.
So we got it. Everyone that wanted to rotate the cameras, thank you so much for your offer. Appreciate it.
But we don't need you anymore.
Easy come, easy go, I guess. I was going to actually call you guys all up to come and start rotating cameras, but I guess
it would be fun.
Oh, yeah. Maybe we should have a guest show up every so often and let them join us.
We need Carly.
Carly's great. Carly said she wants to come on the show. Carly said she's going to interview you.
I know.
Where's Carly at?
I know. I don't know. Carly, where are you at?
Carly, where are you at? Dr. B&T.
Yeah.
Have you ever heard of This is for you for sure. I never heard of it if you're asking. Have you ever heard of HGH? Heard of HGH causing someone's ovaries to become exhausted and go from 30 to 50% blasts over 10 rounds to 0% blasts with HGH? We did 50 units HGH every other day during stims.
No, it's got nothing to do with that. But I mean, I would be incredibly worried about someone that did 10 rounds of IVF. I mean, that is madness. So, no, HGH wouldn't cause that. Your 10 rounds could, but not the HGH.
Can I do my cycle monitoring in Toronto and come to Windsor for my retrieval?
That's what we always do.
Have any partner clinics?
Yeah, we have partner clinics in Toronto. We're part of the Excellence Fertility Group now, and that's myself and Tripod. And so you can monitor there, you can monitor here, you can do whatever you like, and then you just show up at our clinic. Yeah, for sure. Plus, we now have Woodstock coming up shortly, and St. Catharines is already up and running.
Is it normal to not have any symptoms 5 days after an FET?
Yes, absolutely. It's normal to not have any symptoms 5 days after an FET. And please don't go buying pregnancy tests. It just drives everybody crazy. Just wait and you will be fine.
What kind of tube tying do you do? And if I get my tubes tied, can I still do an FET if I choose to?
So we do what patients want, which is either tying the tube or removing the tube. Now, the reason you would tie your tube is if you weren't sure about the fact that you're having them tied and you want to leave the option that you can reconnect them later on. And in this day and age of IVF and accessibility and insurance coverage always growing, it's probably going to be a dying thing. I don't think a lot of people are going to be doing that anymore. I actually just did a tubal reversal last week, but it's going to be a very rare thing in the near future. More importantly is the fact that if you want to give yourself the best protection from cancer, you actually want your tubes removed because it reduces ovarian cancer and it reduces fallopian tube cancer. So those are huge benefits. Can you do an FET? Yeah, absolutely you can. With a tie or with the removal, it doesn't make a difference. In fact, arguably, your chances are better when your tubes are removed because nothing from the tube can leak into the uterus and cause a problem with success. 858.
858. St. Catharines is up and running.
St. Catharines is up and running. They're seeing people. They're doing ultrasounds. The blood analyzer comes in January, but then we'll be like gung ho. And then you and I got to go there and promote it. Like we got to go there and do a live and
have some fun.
Yeah.
Do what we do. Dr. V, can you repeat what kind of priming requirements for me with my high estrogen? I'll ask my RE.
Testosterone, human growth hormone, and DHEA. Yeah, all three.
All right, one more question then. Clinic recommends Zymo for MFI 40% DNA frag.
Ooh.
They say results are comparable to Tessa. Do you agree?
So there is one study from Zymet that showed that it drastically reduced the amount of DNA fragmentation. So that's a reasonable approach. Now, none of the studies have ever, well, actually, that's not true. There's one study that has shown an improvement in outcomes, but every other study that's used the microfluidics sperm sorting, which Zyma is, has not shown a benefit. So I'm not sure if it works or not. What we do know drastically reduces your DNA fragmentation is double ejaculation 3 hours apart. We talked about it earlier in the show. So ejaculate now, ejaculate 3 hours later. The second sample has 80% less DNA frag. Easy, simple, use the second sample. 9 o'clock. You good?
I'm good.
I'm good.
Then we're good.
I think we're good.
I hope you guys had a great time today. Thank you so much for joining Fertility Fact and Fiction. I'm Jared. Go ahead.
And we will see you next week, where we will be talking about the impact of nutrition. And I've got some great studies which I may present talking about meat intake on sperm and your diet health on sperm. And we will talk about all things nutrition related and fertility. So join us, and hopefully you learn a lot. Have a great week, guys. Happy Thanksgiving to all of our American friends. May you have a safe, blessed holiday with family and friends. And if anyone asks you about kids, just say the same thing everybody else should say, which is it's in the works. Just always say it's in the works. And then no one